And it's also a massive honour to welcome to the stage someone who's been a great supporter of GDI since the very beginning, with advice, guidance, strong words when we need them, and genuine help and connections, but also is an amazing social entrepreneur in his own right and is wearing his Paralympic torchbearer's outfit today. Those of you more familiar will notice the torch just to the right of the stage. Dr. Kush Kanodia has been a friend and colleague for a long time, and I'm delighted to hand over to you now, Kush.
Thank you very much, Vicky. Sure. So my name's Kush Kanodia. I'm a social entrepreneur, and I transform systems to make them more inclusive for disabled people. When I say that to people, normally they say to me, like, what do you mean? Like IT systems? I mean like significant systems like the Premier League, like NHS England, like Greater London. So changing the world is my joy. So a strange quirk of fate. A strange quirk of fate was that I was actually the last person to accept to be a torchbearer for London 2012. So we brought in the torch. So the motto of London 2012 was to inspire a generation. And the motto of the Paralympics is spirit in motion. And I would like to believe that is exactly what we've done. So I was reflecting on the last 11 years since being a torchbearer. And we've transformed now 3 of the most significant systems in the UK. And thank you very much for mentioning nothing about us. So that is the disability mantra, nothing about us without us. I'll talk about the last 2 systems today because I realize I've only got a short amount of time. So disabled people have created and led 2 of the most significant innovations in disability inclusion in the UK during the pandemic and the cost of living crisis. So how do disabled people lead innovations and systems change when the systems are so designed against us? In 2019, I was a patient governor of Chelsea Westminster NHS Foundation Trust, one of the leading NHS trusts in England, where they decided they would start charging for disabled parking. In the borough with the highest income inequality anywhere in the country. I explained to them if they did this, I would start a national campaign to abolish all disabled car parking charges from all NHS hospitals in England, as Scotland and Wales had both abolished charges previously. At that point, quite honestly, I didn't even know how many NHS hospitals were in England. I just had inspiration from being a torchbearer and transforming the Premier League. And I thought, if we can transform the Premier League, why can't we transform NHS England? All I knew that I am a disabled person, that it was due to the NHS that I am able to walk, due to assistive technology and having both my hips replaced in 2002. If I could not access the NHS and healthcare, then how could I access education, employment, and be a full participant in our society? A week later, I became an ambassador for Disability Rights UK, the largest pan-disability charity in the UK and the leader of the campaign. Then I attended a summit at the King's Fund, which is a health think tank in London, with some of the leaders in the NHS and the health system. After the Minister of Health and Social Care did his keynote speech, there was an opportunity for Q&A. So I highlighted the evidence base that the United Nations had found that austerity and welfare reform has led to grave and systematic violations of disabled people's rights in the UK, that only 1/3 of London's tube stations are accessible with step-free access, and that disability is now one of the greatest predictors of poverty in the UK. I mentioned what was happening in Chelsea Westminster NHS Trust and the campaign, and I asked the minister for his support. Even though the whole audience applauded the campaign, the minister just ignored my question, like politicians so often do. At the same event, there was the CEO of NHS England, the so-called most powerful person in the NHS. After I asked for his support, all he could do was laugh uncontrollably for about 5 minutes, as to say, how audacious. You think you can challenge the NHS? Who are you? But all was not disappointing at the summit. There were journalists in the audience, and they wanted an exclusive interview. And on the Monday, the campaign was featured in the Daily Mail, the Times, the Telegraph. The following day, we interviewed with the BBC. This led to us working with MPs from all the main political parties. And when the general election was called in 2019, we got the campaign in the manifestos of both the Labour Party and the Conservative Party. And I had agreement from the Lib Dems because I was worried about hung election. And I like to mitigate against risk. So in April 2021, all disabled car parking charges from over 200 NHS hospitals in England was abolished, helping over 2.5 million disabled people to access critical healthcare during the COVID-19 pandemic. We got the UK government to invest approximately £1 billion into this innovative policy initiative. Last year, I was awarded with an honorary degree for Doctor of Science for having an inspirational career as a disability and rights champion and social entrepreneur. Kent University stated that this is by some margin the single largest and most impactful change in the treatment of disabled people in the history of the NHS. A couple of months ago, the NHS celebrated its 75th birthday. I find systems value academic experience and work experience, but not lived experience. So the most critical missing component for innovations in the system is lived experience. In 2021, even before the NHS campaign was implemented, I started the next campaign in London. The Mayor of London was implementing the world's first ultra-low emission zone, ULEZ, in inner London in October 2021, during the height of the COVID-19 pandemic. Now, ULEZ is essentially a £12.50 charge per day for the most polluting vehicles. But many disabled people have no choice but to use their cars due to inaccessible environments to access critical goods and services, health and social care, and there was a lack of reasonable adjustments for disabled Londoners. There was no consideration for the disproportionate impact on disabled people from the pandemic and the cost of living crisis. With 3/5, 60% of all COVID-19 deaths being disabled people, even though we only amounted to 17% of the population, according to the Office of National Statistics. With the support of Inclusion London and many deaf and disabled people's organisations, our campaign was featured in My London, Disability News Service, Evening Standard, Daily Mail, Sun, Express. I even found myself on TV with both BBC London and BBC Politics London. And we even lost a vote at the London Assembly. But we had support from the Green Party and the Conservative Party, and Labour and Lib Dem was against. They had a strategic pact. But in 2023, we did finally win further reasonable adjustments for ULEZ for disabled Londoners, with over 250,000 disabled people now being exempt, with DWP benefits included. We expanded grants from £2,000 to £10,000 for wheelchair accessible vehicles, and we won exemptions for carers and expanded the grace period until October 2027. We welcome these changes. However, they still do not exempt blue badge holders, of which there are approximately 250,000 in London, and many blue badge holders will not receive any of the benefits from the new exemption list. Unfortunately, many cities in England have now replicated the disability discrimination from the original ULEZ with new clean air zones from Birmingham to Bristol. Glasgow has exempted blue badge holders from their clean air zone, so why can't London? Climate action must go hand in hand with climate justice and social justice. Otherwise, all we'll be doing is increasing poverty and an inequality for disabled people in a cost of living crisis, when we've already been the most disproportionately impacted. I believe this is the cutting edge of disability innovation, where two movements meet, climate action and disability rights. But it is not a binary choice. We can have both. We can have clean air and accessible environments. Anyone who wants to do a case study on this, please contact me and I can give you the information. The Mobility Foundation has found that disabled people make an average of 38% fewer trips than non-disabled people, and there has been no reduction in this gap over the past decade. Analysis shows that completely closing the transport accessibility gap for disabled people in the UK will deliver benefits in the region of 72.4 billion per annum. We are now calling on the UK government to create a standardised policy for all current and future clean air zones to exempt blue badge holders in England. Our campaign is even featured in the Disability Action Plan Consultation Question 4 for climate adaptations and mitigations. The consultation closes on the 6th of October, and you're more than welcome to respond, demanding that disabled people's blue badge holder exempt and that we create national policy. I wanted to leave you with some context. The NHS is the 5th largest employer in the world, with over 1 million employees. London is one of the greatest cities in the world, with a population of 6 million people. But the truth is, they pale in comparison with disabled people. London has over 1.2 million, and there are approximately 16 million disabled people in the UK. There are well over 1 billion disabled people globally, with an estimated population being greater than that of China. Disabled people are the largest minority group in the world and still the most discriminated against. But when we unite, there will be nothing that will be able to stop us in our way. Thank you.